Thank you. This year commemoration will take place at Oshuarongo Town, Ochozomjopa region on the 27th of January 2025. There's a screening campaign in all the districts within the Rongo region. Already most of the districts have started already with their campaign. So Valvis Bay and Usakos district started on the 20th of January 2025 to 31 of January. Swakop Moon and Domaru district, their campaign will start on 27 to 31 January 2025. I'm just encouraging all the women of the childbearing age from the age of 20 to 49 to visit all the public health facility in Erongo district. So the cervical cancer screening is for free.
Now, many people might not know what cervical cancer is and how it develops. Can you please tell us what is cervical cancer in layman's terms?
Cervical cancer is a type of cancer that affects the lower part of the uterus. And it occurs when abnormal cells on the cervix grow abnormally. Cervical cancer is caused by persistent infection with human papillomavirus, so that is known as HPV, and this is sexually transmitted. Most of women can clear this infection from their body. However, some women are unable to clear these viruses, and then if it persists, it can lead to changes on the cervix that can cause or lead into cervical cancer if it's not being treated. Women that are HIV positive, they are more at risk at developing cervical cancer than those that are HIV negative. Therefore, it's very important for every woman to get screened for cervical cancer. HIV positive women, they are encouraged to get screened for cervical cancer at the age of 20 and then every 3 years. And then if you are HIV negative, you are encouraged to get screened from the age of 25 years, and this should happen every 5 years.
Can you tell us why is early detection crucial in the fight against cervical cancer?
Cervical cancer is a preventable disease, and if it detected early in the pre-cancer stage, it can be treated. Cervical cancer often develops without noticeable symptoms in early stages, and early detection is therefore a key to effective treatment. This is why it's important for every woman to be screened every 3 years if they are HIV positive, starting at the age of 20 years. And then if they are HIV negative, they should be screened regularly every 5 years. So if they are worried, they should visit the nearest health facility to get more information.
What screening options are available for women in Namibia, and what should they do if they want to get screened for cervical cancer?
So there are various screening options to detect cervical cancer. In Namibia, we are using pap smear in cervical cancer inspection with acetic acid, also known to screen cervical cancer. All women who are 20 years and above can take proactive steps towards their well-being by visiting their nearest health facilities to get screened or get information on cervical cancer screening. You can talk to the staff or any staff at your local health care facility for more information. The Ministry of Health is also running extra outreach programs this month, so look out for this and make use of these services when they come to your area.
Like Sister Mutumbulawa mentioned, women living with HIV are more likely to get cervical cancer compared to women without HIV. Can you tell us why is this the reason?
That is right indeed. Women living with HIV are 6 times more at risk of developing cervical cancer in comparison to HIV-negative women due to their body's inability to fight infections. It's also very, very important to take your HIV medication consistently and correctly to keep the virus under control at all times. But this medicine is for HIV and it does not protect you from cervical cancer. Therefore, if you are HIV positive, it's very, very important to get screened every 3 years. Take note. This means you can get any preventive treatment you need to stop your body from developing cervical cancer. Getting screened is quick, easy, and it can save your life. If necessary, treatment can be provided during the same visit on that same day.
And just finally, what can men do to support women in getting screened for cervical cancer and reduce the risk of HPV transmissions?
Thank you for this question. It's also very, very important to emphasize on men. And men can encourage women to get screened for cervical cancer. If you have a sister, ask her if she has been done or screened for cervical cancer before. You can ask your wife, girlfriend, or even your mother. Your encouragement may be the motivation someone needs to get screened. They can also get circumcised. In so doing that, they could reduce the transmission of HPV virus, which causes cervical cancer. In addition, they can use condoms and stick to one sexual partner to reduce the risk of human papillomavirus because the virus is likely to hide in the foreskin. They can also support their daughters to get vaccinated against the human papillomavirus before they become sexually active when this vaccine becomes available through the Ministry of Health.